First here on Color 10 at 6 tonight, a new resource for mental health and substance abuse.
This afternoon, Greene County pledged $1 million of taxpayer money towards opening a new behavioral crisis center. Color 10's Jesse Inman is here tonight with more.
Yeah, guys, several powerful groups have come together to make this possible over the last 3 years or so, and soon Greene County will soon have another resource available for people facing a mental health or substance abuse crisis, and they'll be able to access that around the clock.
We don't need to be putting people in the hospital or in jail that don't need to be there, but that's the only place we've got to go with them. We need someplace that can get them help.
That's something that resonated with Greene County Commissioner Harold Bench a few years ago during a conversation with Springfield Police Chief Paul Williams. So in 2017, the groundwork for getting another effective resource for mental health and addiction treatment was laid out in the form of a half-cent sales tax passed by the Greene County voters.
We went to the taxpayers and said, this has been determined to be a real need for this community. Taxpayers said, okay, let's address it, and they voted to do it.
That was followed up by a local 15-month study, and Springfield Greene County Health Department Director Clay Goddard says that study determined what was really needed in the county to fight those issues.
We identified crisis access as really one of those areas that we really needed to develop resources for.
So today, the Greene County Commission and Borough President C.J. Davis signed an agreement that will devote $1 million of the money generated from that 2017 sales tax to repurpose Borough's building on Park Avenue into what they call their rapid access unit.
And from there, we'll stabilize them. If they need additional care, we'll move them into our crisis center where they can stay for 3 to 5 more days. And then also attached in that building is our social detox program, which is a 30-day program. So it's really a true crisis center. All the services that you would generally associate with a crisis center all under one roof.
But that center will be able to see people on a walk-in basis, but EMTs and law enforcement will be able to drop people off there as well, which could reduce the jail population, something I know Sheriff Jim Arnott will like, and also reduce wait times at the ER. And that center should be open in early April and will operate 24/7, 365 days a year.